Hey guys, good morning. This is Frank. I made a little summary for myself for the course of Comparative Health Policy, and I think it might also provide a helpful overview for you, so that's why I record it now. Feel free to share it with anybody close if you like, and let me know if I miss any important or essential concepts of the course. Okay, I will first explain you what you actually see here and what the colors stand for. So the pink ones here and here and here are for the lectures that we had. Then the green papers are for each article that we've read. And in blue here below you see the main concepts that are described in those papers. And eventually it all comes together in the central line of the course. So this is also a little bit how I walk through it now and how I keep an overview for myself. So in week 1 we first had a lecture of Marianne van Bochhoven, where she really said like that we have 3 perspectives to keep in mind: a governmental, institutional and comparative perspective. And in week 1 we merely focused on 3 papers: Pierre, Ted Marmor and De La Porta. So Pierre, to take them one first, focused mainly on governance and explains that governance is an umbrella concept, and there are many different ways to think about it. So in one way is to compare government, which is a narrow concept, versus governance, which covers more like a wide range of institutions and relationships. Pierre also explains about the 4 arrangements, government arrangements: hierarchies, markets, networks and communities. If we take the blue paper that I wrote, it can also be described as steering. Steering basically how citizens are steered in the right direction. And if you look at how many different actors are involved in governance, it's not merely the state, but there's also, for example, the EU and the municipalities. And if we look at this level, we look at multi-level governance, but there are also other actors that are more dispersed networks of power and control. Then second source is Ted Marmor. And Ted Marmor looked at comparative health policy and really what is it about? Asked the question what are the 3 purposes? So first of all, he explains advantages and risks or disadvantages. An advantage is two things. First, you get a different perspective. And second, it's kind of like a semi-natural experiment. And he says that the 3 purposes are learning about, learning why, like we also applied in our papers, and a third, that you can take the policy lessons from experience. The third article is from De La Porta that explains how institutional analysis can be done. So basically you have case-oriented versus variable-oriented analysis, and it's quite kind of logic where variable oriented analysis has a higher amount of states or comparisons, countries that you compare, and case oriented often 2 or 3, but you go more in depth. And she also explains difference between the most similar and the most different design, which is kind of like obvious. Okay, then in week 2 we get the lecture of Hester van de Bovenkamp about institutional theory, and there are 2 main sources, Steinmo and Mahoney and Thelen, that explain about this. And Mahoney and Thelen actually talk about Steinmo talks about historical institutionalism, which is mainly about continuity, and institutions can mainly changed by external shocks. And they explain historical institutionalism to be in between rational choice and sociological institutionalism. Mahoney and Thelen, on the other hand, they say no, it's about gradual institutional change, because institutions are formed by coalitions and compromises and are therefore inherently dynamic. And yes, previous research looked at exogenous shocks. But Mahoney and Thelen look at incremental and endogenous development. And they also talk about the concept of path dependency, which means that institutions are subject to self-reinforcing lock-in. So that's why they stay the same. And furthermore, they talk about 4 ways in which institutions can change. First, displacement, so the removal of one institution displaced by another, layering one institution on top of the other, drift, the changed impact because of environmental, so difference in environment, and conversion, changed impact because of kind of like strategic redeployment. And of course, institutional theory is the central thing that is applied here. In week 4, we basically had 2 lectures. Lecture of Hans Vollard from the EU and of Iris Wallenberg. And Hans Vollard actually talks about 2 main questions, 2 main puzzles as he calls it. How is it possible that the EU, what explains the EU involvement in healthcare? Because many countries, or actually most countries, do not want involvement of the EU in healthcare, so they could rather keep it national competence. And second puzzle, what explains the difference in implementation of the Patients Directive in this case, but I think it's in the general in the course, what explains difference in implementation. The second article, or second lecture in the week was from Iris Wallenberg about the role of actors in institutional change, and this focused on institutional work. So institutional work, the main source about it is from Lawrence, 2011, and he basically says that emphasizes the role that individuals have in creating, maintaining, and disrupting institutions. So it focuses mainly on the why and the how, and not necessarily on the what and the when. That's actually the central message. Then we have TRIBE, and TRIBE is focusing on EU also, implementing and complying with EU governance and outputs. And these are the main messages. He says, like, it's about the goodness of fit, the willingness to comply, and the capacity. But implementation is not that like easy, or not that because it's based up on transposition, application, and enforcement. And he also talks about the 4 waves, which is quite like a lot of text. But I think the main thing that I try to remember there is that it's the 4th one, so the last wave, focuses on member states' reaction to the European Court of Justice rulings. And that's where they went more active in the European Committee, if I'm not wrong, if I'm correct, to be kind of like more proactive in making the rules. Speaking of rules, Imre Good has written an article in 1992 actually already about the rules of the game, and where he compares France, Switzerland, and Sweden. And yeah, he explains that the strength of institutional analysis is to show why there's a difference in policy inputs or outputs might be also linked different in different political systems. So basically, if he speaks about rules of the game, that's a central theme in this paper. Rules of the game is basically like institution structure, the menu of choices available in different regimes. And he also speaks about role of veto points there. Let's see. Institutional work. We've had now critical junctures. That's just something to go back in STIMO. You can read it here, period of contiguity, during which usual constraints on action are lifted or eased. So in which it is more easy to create a change in institutions. Basically explained in STIMO. Then the last week started with the lecture of Roland Ball about policy learning through international comparison, and we have had 3 papers that focused on that. First of all, the one of Nielsen. Nielsen was about traveling frictions, and it talked about the global disease self-management program, and basically it was, I think, made in the USA, but the analysis took place in how it was developed in Denmark, or how it was applied in Denmark. And themes that you can see here, it should be evidence-based. Scripting plays a big role, friction. And the central message, one size does not fit all. So programs must be culturally neutral, yet transferable. 2 papers left. First, the one of Clavier. And Clavier talks about the bottom-up policy convergence and emphasizes the role of local actors and proximity in that. And he compares France and Denmark. And this was about like the nurses that really influenced the implementation there. So yeah. Let me check. And last of all, to look Bennett, also quite an old source, 1991, and talks about policy convergence and what causes it. So first of all, what is convergence? Do you still remember? So convergence, I think, is like the process of policies moving more towards each other. And basically there are 4 types of convergence: emulation, elite networking, harmonization, and penetration. In which emulation, we got the example of Taylor Swift, if I'm not mistaken, and the other picture of the boy who wanted to look like Taylor Swift, and the others. Yeah, we went into that during the course. This is just for an overview. So we've had the main lectures, the main articles. This is just the red thread, as we say in Dutch. So the central line, and it was by the 3 puzzles. First question: why are health policy reforms so difficult to undertake? I think you need willingness and capacity to change, as we saw now in TRIPE. Then institutions are relatively stable and difficult to change. This is from the perspective of historical institutionalism, displayed by Steinmo, and also gradual change, and actors play a big role, which is basically like gradual change. Change is described by Mahoney and Thielen, and actors, the role of actors, by Clavier. Second part: why are healthcare policies different across national context? So especially what we just talked about, convergence from Bennett is really important in that. Then also the bottom-up policy convergence, where Clavier emphasized the local actors and proximity is important, and the fact that one size does not fit all. So it's really because of different cultures also why they differ. And that's exactly where we start with the last question: what are conditions for successful policy learning? First of all, culture. Can we need to have the same ideas and values as displayed by Nielsen? The implementation requires a lot of work, so it's in scripting, in standardizing, and after that adapting it to the other country in Nielsen, as we saw in Nielsen where they talked about Denmark. And last but not least, we also have to take into account the local actors as described by Clavier. I hope this overview was kind of like helpful for you, and let me know if there's anything missing. Good luck with the exam.